My name is Andrea Wannett, and I'm the project manager for Millennium Collaborative Care's Behavioral Health Integration Project. The overall purpose of this project is to coordinate care for both behavioral health and primary care services. Behavioral health services may include mental health and/or substance abuse services. Physical health issues include acute illnesses such as fevers, strep throat, and infections, while a chronic physical illness is an enduring health problem that can be managed but cannot be cured. Some examples of chronic illnesses include diabetes, asthma, arthritis, or cancer. These diseases and other acute illnesses are typically addressed in the primary care setting. With this project, some of those typical ailments addressed within each setting will change as behavioral health issues are managed in a physician's office and certain physical ailments will be managed in a behavioral health center. This project aims to combine the two services into one convenient location. Therefore, there are two models of integration we are focusing on. Model 1 focuses on the integration of behavioral health services into a primary care setting, and Model 2 focuses on the integration of primary care services into a behavioral health setting. In order to effectively reach the final goal of behavioral health integration, it is important to create some evidence-based standards of care. Some of the areas we will focus on include medication management and care management protocols. In addition, one of the main areas we will be focusing on will be in the preventative care screening area. The Patient Health Questionnaire, which is commonly referred to as a PHQ-9, and Screening and Brief Intervention and Referral for Treatment, also known as SBIRT, will be implemented in order to assess patients for depression and/or substance use disorders. We will also be focusing on tracking patients who are engaged in this project by the use of electronic health records. Another goal of this project is to help ensure that folks live longer and healthier lives. One of the main reasons why this project is so important is because the system needs to be transformed so that we can more adequately serve people with mental illnesses. Some alarming statistics show that people with mental illnesses typically have a shorter lifespan than the general population. In addition, 68% of adults with a mental illness have one or more chronic physical conditions, and more than 1 in 5 adults with mental illness has a co-occurring substance use disorder. Chronic health conditions co-occur at a higher rate for individuals identified with a mental illness versus those without a mental illness. Examples are shown, which include high blood pressure, smoking, heart disease, diabetes, obesity, and asthma. So, what can we do? The solution lies in integrated care. If we can successfully coordinate mental health, substance abuse, and primary care services, we can more effectively serve individuals with more complex healthcare needs. Various levels of integration currently exist in our healthcare system. At level 1, there is limited integration, and folks tend to work in their own separate silos. Some referrals for specialty care may occur at level 1. At level 2, caregivers are screening for depression, substance use, and/or other behavioral health needs. In addition, referrals are made in a more timely manner for patients identified. At level 3, a physical co-location of services exists for providers. Some local practices have attempted this model, yet are not quite fully collaborating on cases. However, because of close proximity, referrals can occur much quicker. Level 4 integration includes a close working collaboration among the behavioral health and primary care providers. Shared spaces are utilized along with coordinated treatment plans. The teams would meet at least weekly to discuss treatment plans for patients and challenges faced. The only main thing lacking from this level of integration is a shared electronic health record. Level 5 includes all of the facets mentioned in Level 4 and also includes a shared vision and shared electronic health record systems. Millennium Collaborative Care strives to ensure that partner agencies move along the levels of integration continuum. A helpful model to review when considering implementing behavioral health integration is a 4-quadrant model, which demonstrates suggested protocols for those with lower or higher severity physical health ailments and lower or higher behavioral health issues. You can see, for example, that the recommended protocol for individuals in Quadrant 1 who have less severe behavioral health issues and less severe physical health issues are much different than someone in Quadrant 4 who has severe behavioral and physical health issues. Many of Millennium's partners are participating in this project. Groups include behavioral health organizations, primary care practices, hospitals with behavioral health and/or primary care locations, and federally qualified health centers. For more information about the Behavioral Health Integration Project, please contact Andrea Wannett at Millennium Collaborative Care at 716-898-6427 or by email at awannett@millenniumcc.org.